So remember, in the SFMA, we find that our patients have two types of generic impairments: stability problems and mobility problems. Mobility problems are pretty easy to assess. We go in, we assess the biomechanics of that particular segment of the body or joint in the body, and we figure out what we need to work on to restore that motion. Stability problems, on the other hand, a lot of times those aren't really true strength deficits. They're actually motor control problems, or the ability to sequence and time your muscles. And one of the best assessments that we have to analyze if someone is able to turn on those basic fundamental stabilizers are our rolling patterns. So think about development again, just like we talk about in our 4x4 with our regress to progress type methodology. We're going to think about the first thing that we learn how to do in gross motor patterning, motor control, and that's rolling over from our backs to our fronts and our fronts to our backs, which happens when we're babies. A lot of times we lose the ability to do that nice rotational patterning, and that pattern helps us turn on our basic fundamental stabilizers throughout our core and our spine. So I'm going to demonstrate all the different patterns of rolling for you, and then we'll talk about some ways that we can intervene to help restore proper rolling patterns utilizing our CLX bands.
Begin by lying with arms and legs extended. When rolling with the upper body, be sure to keep the lower body completely relaxed. Your legs and hips should not be assisting the movement. Reach up and across the body with your arm, making sure to lift and rotate the head in the direction you are rolling. This should be a controlled movement completed without using momentum. When rolling with the lower body, the head and arm should remain relaxed, not assisting the movement. Reach your knee up and across your body to complete the roll in both directions. When rolling over from the back to the stomach, the body as a whole should be flexing. When rolling over from the stomach to the back, the body as a whole should be extending. You can also use the TheraBand CLX to cue the patient to elongate the axis either through the upper body or the lower body. For example, in this upper body driven roll led with the left upper extremity, place the CLX on the right upper extremity and the left distal lower extremity to encourage the response of elongation.